Hello guys. Today we'll be discussing about development of temporomandibular joint and short form is nothing but TMJ. Okay, what is temporomandibular joint or TMJ? Well, we all know that the mandible is not directly connected with the cranium, correct? But it articulates with the cranium in at the temporal region, okay, which is present at the base of the cranium, and that is why the name temporomandibular joint. Now it's often described as a complex joint. It is multi-axial. It has synovial fluid. That's why it's also known as synovial joint. It has condyles which are present bilaterally. That is on both the sides. That's why it's also known as bicondylar. Other than that, it is also known as glenoarthrodal joint. Let's understand what is a glenoarthrodal joint. Well, a joint that can perform complex movements like hinge movement as well as gliding movements, they are known as glenoarthrodal joint. Okay, that is why TMJ is known as a complex joint in the body. Okay, do you know when temporomandibular joint or your short form which is TMJ is developed? Well, it is developed in 7th to 11th week of gestation period. Okay, and it's developed from Meckel's cartilage. Now, Meckel's cartilage is nothing but first branchial arch, okay, as well as ear ossicles also play important role in early development of TMJ. All right, now let's learn in detail how actually TMJ is developed or how it's formed. Okay, we all understood that TMJ develops from 7th to 12th week of gestation period. Correct? So what happens in the 8th prenatal week is a mandible which has not formed a shape yet, but is just a cylindrical rod of cartilage which is known as Meckel's cartilage. Okay, it posteriorly fuses with Mellis cartilage and articulates with incus. Alright, now as the gestation period further progresses between 8th and 12th week of fetal life, cartilaginous condyle starts to develop. Now this cartilaginous condyle starts to develop anterior to malleus and incus. Okay. Further, this cartilaginous condyles undergo endochondral bone formation, okay, and fuses with the posterior part of bony mandible. Got it? So now we understood that the TMJ has started developing from Meckel's cartilage. Okay, Malleus and incus play important role in further development of TMJ. Correct? So now Meckel's cartilage, Malleus and incus lies medial to developing mandible. Okay, and forms secondary joint which lies lateral to the cartilaginous rod. Okay, and is anterior to the primary joint. So which one is primary joint? Well, the hinge joint is the primary joint. Okay, and what happens for the first 16 to 18 weeks of prenatal life? The articulation of malleus and incus functions as primary TMJ, which only has hinge movements, and that is known as primary joint. Okay, and as the further gestation period starts to progress, there is further developments happening. Okay, and in the primary TMJ function, that is only hinge movements are present, there is no lateral excrusion that is present. All right. So post that, what happens is the malleus and incus further undergo endochondral bone formation and become middle ear bones. Okay, just a short recap of what we learned till now. So we understood that the Meckel's cartilage, malleus and incus together helped in development of TMJ. Alright, we also understood that Meckel's cartilage and incus ended up forming the bones of the middle ear. Alright, and we understood the development of cartilaginous condyle which further underwent endochondral bone formation. Got it? Hope we are clear till this point. Now let's understand how mandibular fossa is formed. Well, it's in the cranium. Okay, so appearance and ossification of mandibular fossa of temporal bone is earlier than condyle and occurs with increased cortical thickness and density of bony trabeculae. Alright, it is formed in the temporal region of the cranium at the base of the cranium. And at 22 weeks, the mandibular fossa shows both medial and lateral forms. Okay, and even the articular eminence become prominent and evident. So articular eminence is nothing but a triangular shaped bone is which is a good density bone. Okay, which we'll be seeing in the further slides. Okay, now let's talk about the articular disc formation. First, let's understand that the inferior portion where the condyle is located is mandibular compartment. Okay, and the superior portion is nothing but a temporal compartment. Now, articular disc formation starts in the inferior compartment or mandibular compartment, and it starts at the 12th week of fetal life. Now, how it starts? Well, it starts with the first appearance of temporomandibular joint cavity, okay, in the inferior or mandibular compartment. Then a split appears in the synovial mesenchyme overlying this condylar head, which further extends to form a small cleft, which is nothing but your lower synovial cavity that is formed. Then 1 week later, the same process happens in the superior region, okay, or in the temporal compartment, and then your upper synovial cavity is formed. Now, in between both these cavities, there is a soft tissue which is there, which is very rich in nerve supply and has good blood supply too. That is, it is very good, it has very good vascular supply. Okay, now if we look at this articular disc which is formed, it is thin at the center and the peripheries are thicker. So naturally the nerve supply and blood supply is good at the periphery rather than at the central portion or in between, okay, intermediate region. Got it? Now it, because of this type of anatomy of articular disc, it helps in movement of the condyle in the mandibular fossa, okay, and it also helps in avoiding friction. All right, and we all understood that there was synovial cavity, inferior as well as superior synovial cavity, which was formed, and this is called synovial cavity because it contains synovial fluid. Okay, so we spoke about the articular disc formation and we understood the shape of the disc, right, which was thin in the center and thicker at the periphery, and we also understood that it is formed from the superior and inferior synovial cavities. Okay, so this superior and inferior joint progressively appears as a small spaces or clefts in the mesenchymal tissue block, which further gives rise to condylar cartilage, articular disc and mandibular fossa. Okay, and the shapes of these joint cavities are always reciprocal to each other. That is, if the upper joint cavity is concave, the lower will always be convex. Okay, now let's have a quick recap. Remember what happened in the starting, in the 8th prenatal week? What happened in that period? So, in that period, the Meckel's cartilage was just a cylindrical rod, remember, which had fused posteriorly with the Meller's cartilage. Now, what happened to that anterior part of the same cylindrical rod? Well, in the 10th prenatal week, what happened was this anterior part of the Meckel's cartilage ended up fusing with the medial wall of mandible. Okay, and it further underwent endochondral bone formation. So, as the mandible started to increase in size or became enlarged, the Meckel's cartilage became relatively smaller. Okay, now we all know what happened to the malleus and incus. It formed the bones of the middle ear. Okay, now that had started by the 16th week. Correct? Also remember in the 16th to 18th week, our first the primary function of TMJ had started, which was a hinge movement. Correct? Then the Meckel's cartilage started degenerating in the area anterior to ear. Okay? And formed two ligaments, anterior malleus and spinomandibular ligament. Okay? And then by 18th to 20th week, the secondary temporomandibular joint movement became functional. Okay? And with that, the Meckel's cartilage functions were over, so it ended up disappearing. We spoke a lot about early prenatal development. Now let's talk about late prenatal development. So there are few major changes happening in the temporomandibular joint as it starts functioning between 18th to 20 prenatal week. So the condylar bone and temporal bone increases in size and density. Mandible undergoes changes in shape and size associated with differentiation and functions of muscles of mastication. There is appearance of clefts in the condylar head which carry blood vessels into rapidly growing cartilage, and general thinning of the cartilage of condylar head also takes place. Okay. Now let's talk about the postnatal growth and maturation of TMJ. So, further, the growth of TMJ continues in the second decade of postnatal life, and the temporal fossa deepens as bone forms laterally on the skull, and articular tubercle enlarges by further bone formation. So, the articular surface of fossa is covered by fibrous tissue, and synovial membrane cartilage thins over this condylar head. So, that's how the TMJ is completely developed. Okay, thank you.